Hi, this is Ian Wright, and I'm going to have a little chat this afternoon, which is kind of part two of a subject I kind of introduced to, must have been, October, I think I did the first part of this, which was to do with managing long COVID and some thoughts and ideas about that. There's no claims in this, it's just experiences and sharing some of the research that's come out. This is an update, but there'll be more and more updates just so that we can keep up with it, because the research is changing all the time. So I'm just going to chat for a second while people come. Most people I know will look at this later, because everyone's probably at work. So anyway, right now I was meant to be doing part two of my cranial pediatrics courses, but I've been held up, and I'm actually right now putting together a course in pediatrics for the Brazilian osteopaths and they sound like they've got some wonderful projects over there, charities treating street kids, and there's one particular project where they're looking at treating children with who've had the Zika virus and children with microcephaly, which would be quite fascinating. And I would love to go over there and see what's going on, but at the moment we're just to create some courses for them. And so I'm actually in the process of doing, for practitioner courses, my cardiovascular one, Stillness, Light and the Heart, which it takes a long time because there's such a lot of research involved, and some of these embodied practices and practical stuff. So these things take a lot longer than I would have thought they would. But also at the same time, I'm also creating a course which is around self-care and kind of restorative and stillness practices for practitioners and carers, because right now carers, if that's someone who's caring for another person in a house, or medics or whoever, there's a huge burden for them, and a process of self-care and anything can support self-care in those situations, I think is really important. Then I'm going to do parts 2 and 3 of the cranial pediatrics online stuff. But again, they take a long time. And then I think hopefully by about May, I'm hoping to do a remote healing online course, because there's a lot of people asking for it at the moment. And it's a fascinating subject and amazes me. And for actual practical hands-on courses, I'm hoping that the Daisy Clinic in Ireland, the kind of charity children's clinic that we have, and the diploma in pediatrics will get going again, I'm hoping in May. And there's a weekend in November booked in Ireland for that. In June, we're going to do part 2 of the Developing Palpatory Precision course in London. I've got courses booked in September and October in Italy and in France. And then there's a mother and baby course in London, I think, which is in October, and possibly next January going to Australia. So there's towards the end of the year, hopefully everything will be very busy and we're going to get back into more hands-on stuff. So anyways, let's talk about, I'm just going to discuss a little bit about from a kind of pre-peer reviewed research paper, which came out, actually it's not out yet, but it was reviewing, came out on the 27th of December. So it's got a license for preprint. So it's like, what happens is when they're licensed for preprint, it's helping in the speeding up the process of peer reviewing it. It just it speeds that up. And it's a research undertaken by UCL London, Cornell University, and a university in Portland, Oregon. And it's called Characterizing Long COVID in an International Cohort. So it's taking a kind of window of 7 months of symptoms with people with long COVID and their potential impact. So, I mean, the objective of this research was to characterize and profile and look at the actual impact on long COVID. So this was taken 56 countries, The ages involved were normally between 30 and 60 years old, and this is symptoms over 90 days. But only about 8% of these cases were actually initially hospitalized. So most of the people weren't hospitalized, but they're still suffering from long COVID. What they found, which is very, very interesting, is there were 205 different groups of symptoms affecting 10 different organ systems. The most common symptom was fatigue, which 80% of people were suffering from. Second most common is malaise after exercise. So post-exertion, feeling quite unwell. And this is a very common thing. And the third one is cognitive dysfunction. And I'll come to this later when I discuss post-viral chronic fatigue type symptoms, because both those symptoms of cognitive dysfunction and post-exertional malaise are signs, really, of chronic fatigue type situation. So after 6 months of these symptoms, because this was a 7-month window, the participants were averaging 14 to 15 symptoms a month, and high percentages of them would get relapses with exercise or with physical, mental activity and stress. So most of the cohort that were examined had no change in symptoms after 7 months, and most could not work. So it's pretty debilitating. So they define long COVID as a collection of symptoms that develop during or after COVID-19 and continue for over 28 days. That's basically their kind of diagnosis of that. Fatigue, most. Post-exercise malaise, 80%. Changes in temperature variability, changes in temperature. So there's a difficulty in the hypothalamic regulation of temperature, which we'll come back to. Chills, flushing, night sweats, disturbances in the skin sensations, weaknesses, coldness, low temperature. 60% still suffered with sore throats, but there were a huge amount of different symptoms: blurred vision, visual changes, difficulty swallowing, light sensitivity, dry eyes, runny nose, eye pressure, floaters, ear pain, facial numbness, paralysis. So I'm just going to go through each organ system just briefly because it's kind of interesting. In the lungs, okay, dyspnea, difficulty breathing, dry cough, low oxygen SATs, cough, mucus, wheeze, sinus, coughs. Okay, in the gut, diarrhea, 50% still had diarrhea. Changes in appetite, decreased appetite, nausea, abdominal pain, gastroesophageal reflux, constipation, vomiting. A lot of skin issues, itchy, 30% had skin itchiness in the skin, 30% had rashes, COVID toe, vascular changes in the toes, chilblainy kind of thing, peeling, increase in allergies. So the immune system had become sensitized. Discoloring of the nails. So in the neuropsychiatric department, we got 60% with anxiety, and I'm going to talk about all that later. 50% irritability, depression 50%, mood, lability, tearfulness, apathy, sense of doom, loss of sense of reality, disconnection, anger, impulsivity, to extremes of delusions, mania, etc. So there's a lot of central nervous system neuropsychiatric, and that's not the cognitive stuff, which I'll come to. Sensory motor, vertigo, dizziness, 70% had vertigo and dizziness. That's high. Tingling, pins and needles, tremors, numbness, sound sensitivity, tinnitus, neuralgias, vibrating feelings, low-level vibrating feelings, shock, hot brain, headaches, migraines, of course, continuing loss of smell taste, phantom smells, altered smells, disturbed smells, heightened senses through those areas. Speech and language, difficulty finding words, difficulty stringing words together, difficulty in communication, difficulty in processing, and sometimes even slurred speech. Sleep, another thing we'll come back to because it's really important, is insomnia. 70% insomnia, 50% waking, okay? And vivid, wild dreams, nightmares, restless legs, sleep apnea. Cardiovascular, 85% still suffered some degrees of palpitations. Tachycardia and chest pain, 60% chest pain. Musculoskeletal, tight chest, tight ribs, muscle ache, 70%, joint pain, 50%, stiff neck, 40%. Immune system, old allergies ramped up in 12-15% of people, and 8% of people suffered with brand new allergies. Genitourinary, 35% of women had changes in their periods. Bladder control issues, sexual dysfunction in males, 15-20%. Cognitive, brain fog, 85% brain fog. Poor attention, 85%. Difficulty in processing and thinking, problems with executive function, 60%, and memory issues, holding memory. So the three most debilitating symptoms are fatigue, breathing issues, and cognitive dysfunctions. 85% of the people who were surveyed experienced a regular relapse, almost in a regular monthly temporal pattern. So the triggers for that are stress, too much mental activity, menstruation, alcohol, too much heat, physical activity. Only 4% experienced a break in symptoms, and this is after 6 months. Only 4% ever experienced a break in symptoms. That means it's stuck, and that's a problem. So the most common symptoms remaining after 6 months was fatigue, brain fog, headaches, memory, insomnia, breathing, and balance issues. So this idea of returning to baseline, coming back to your normal baseline is not happening. It's very, very slow, and there's a very poor level of recovery and this tendency to relapse. And there's this dysautonomia, which manifests as like POTS syndrome. So it's a postural orthostatic tachycardia. So when you come up from lying down, you either get very fast beating tachycardia, or you get dizzy. So you get lightheaded, dizzy when you stand from sitting. This shows a autonomic nervous system. It's a sign of autonomic nervous system disturbance. It doesn't regulate. It doesn't self-regulate itself, and so the heart rate and the blood pressure are dysregulated. It's caused by this autonomic dysregulation, and that's an important part because you see that in myalgic encephalomyelitis or chronic fatigue syndromes. It's one of the two key symptoms, and I will talk about that in a little bit. But this autonomic dysregulation is one of the factors I think that's really involved with this. So, okay, so what's actually going on? That's the research. That's what people have been shown. So what's actually going on here, really? If you saw my last lecture, where basically I talk about the virus, the viral function, how the virus enters the cells, the changes in the cell, where the virus tends to attack, which is actually not just the respiratory system. Obviously, it attacks a whole wide variety of areas, but it has a particular effect on the endothelium, the vascular, number one, endothelium, which is huge. And it has an effect on all of the different endotheliums, like the lymphatic endothelium. What I found a lot is some of the ducts, like the pancreatic ducts, the inner linings of those are quite strongly affected as well. But it doesn't just affect that. It has a strong effect on the cardiomyocytes. It actually dysregulates them on a DNA level. It has an effect on the immune system. There are T cell changes and natural killer cell changes, it seems. Also, it gives us the opportunity for these opportune infections to raise their heads. Other viruses, bacteria, etc., actually, and parasites seem to engage and take over because the immune system is compromised. So there is this, it's like a chronic fatigue type situation, but a little bit more so because there is this particular effect on the vascular endothelium. And that's what we're going to kind of talk about that. So this idea of endotheliitis, which is an inflammation of the vascular endothelium, which affects the gap junctions, causes local inflammatory changes, flow disturbance. And a lot of my time is spent when you're working with people looking at the vascularity, the capillary beds, the flow. There's a flow disturbance, but also it's the same within the lymphatic system. And the vascular endothelium, it has particular areas where it seems to affect. And this is to do with the brain, the viscera, especially some of the great vessels, the aorta, the external carotids. The middle cerebral artery is often affected, which has specific effects on the limbic system, seems to be particularly open to problems. Actually, it seems to have that effect, and that causes problems with the amygdala, and that links up with anxiety issues, and the hippocampus in terms of memory issues. So anyway, we'll talk about that all. So the other side of it is the connective tissue is affected. There's a strong effect through the connective tissue. For example, the dural membrane. The dura just does not, it just locks down. There is no fluid fluctuation. And because the dural membrane locks down, it seems to have an effect on locking down the CSF fluctuation, especially the longitudinal fluctuation of the cerebrospinal fluid. And it's interesting, that whole idea, and if you listen to some of my previous lectures on the process of this natural CV4 when people are in shortwave sleep. So when you're in, this is about some relatively recent research that came out last year when they were looking at the fluctuations of the cerebrospinal fluid in shortwave sleep. So what happens in shortwave sleep, in the slower, deeper sleep, the cerebrospinal fluid migrates from the extradural spaces into the ventricular system. And if you're familiar with cranial osteopathy, that is very much like a CV4 or a CV3. So when there's difficulties in sleep, you don't get this natural fluctuation, deep regulatory fluctuation of the cerebrospinal fluid, which actually acts to detoxify and helps the metabolic processes of the brain and its recovery. So you don't get that because of the sleep. Now, what comes first? Is sleep affected because there is this lack of fluid fluctuation? You know, the third ventricle is locked down. The back of the third ventricle is the pineal gland, of course. Interesting area. But restoring this fluctuation, this longitudinal fluctuation of the cerebrospinal fluid by working through the third and fourth ventricles can help with that. It helps with that process. That's one of the most important beginning points to do, is just to restore natural CSF fluctuation. That's hugely important. But also we've got other connective tissues that have no fluidity. For example, the pericardium is often cases is so solid. I've never felt pericardium like that in a lot of the cases that I've seen. There is no glide in the fascial planes, and that is right the way through the lung fields, of course. the diaphragm, the central tendon of the diaphragm locks down because of the breathing issues, and that can affect the function through the left arcuate ligament onto the left renal artery, and that can cause vascular blood pressure issues in itself. So, and also the diaphragm, because it's locked down, it has an effect on weakening the venous return. The inferior vena cava has no valves, and it needs this excursion of the diaphragm. So you have to restore the basics here. The lung fields, the alveolar capillaries and the alveolar endothelium of the alveolus are damaged, and that's the primary effect of the respiratory element to this illness. And so what we've got are areas of the body that primarily seem to be affected through their vascular endothelium, which alters the flow dynamics to the organs, causes altered flow, congestion, lack of drainage, capillary bed lack of function, etc. But also the lymphatics to the organs are affected through these inner linings. So the spleen has a huge, the large vascular supply of the spleen that sits underneath the diaphragm is very, very, in a lot of the cases I've seen, is very strongly affected. And interestingly, in a lot of the cases I see, for some reason, the left side of the body, now that may be just a coincidental thing, has been affected quite strongly. And the spleen, if there was one organ that I've come across that's been affected most, it's the spleen. And probably for obvious reasons, but it's fascinating. So just looking at complications and with a few of the people I've been treating, they have this idea of opportune infections. Epstein-Barr virus, for example, old viruses that have been around before, Coxsackie virus, Candida, enteroviruses, etc., bacteria, parasite infections. For example, people can get chronic sinus infections afterwards, but they are strongly bacterial, and it's like the immune system is compromised, the gut biome is not functioning correctly, and that's a very important part of it is the gut biome. Often there's been sequences of antibiotics which haven't helped that. So actually we need a good probiotic. That's one of the first things we need to do. But you have to deal with these other opportune infections which seem to take over, and most of these cases there's no active coronavirus function that's happening in the body, it doesn't seem. But you have all these other infections that seem to come in and cause problems. So what we've got when we're going through this are these layers and layers of healing, and it can actually be painful as these processes and each step of the healing the organs can actually hurt. Things can actually really be painful as people go through this whole process of unraveling all of this damage. And what has struck me working with these cases is the amount of, in some of the cases, you literally are going through working with every part of the body, all the different organ systems, from the brain to the gut, to the liver, to the spleen, to the lungs, especially to the heart. And they all have to go through this process of healing because they have been literally, I think, damaged. That's my experience, certainly in some of the more severe cases I've been working with. So it does link up with this myalgic encephalomyelitis, which is the ME thing and the chronic fatigue. They don't really like to use the term ME anymore because they really, it's not favoured because they don't find any lab or imaging effects in the brain. But there is brain fog, and cognitive dysfunction is a key sign of ME, as is this orthostatic intolerance, meaning the changes when the dizziness or the tachycardia when you sit up or stand up from sitting or lying. So it's the change and that inability of the autonomic nervous system to self-regulate. But what they found with this post-viral type symptoms are changes in the immune system, okay, impaired natural killer cells, T cell dysfunction, elevated cytokines which is what you find inflammatory, pro-inflammatory markers, is what you definitely see huge amounts in COVID, long COVID, very much so. Also, autoantibodies, for example, rheumatoid factor or antithyroid factors. So that it's like the immune system starts working a little bit against itself, as it were, in an autoimmune kind of way. Hormonal dysregulation, diarrhea. And these symptoms are very close, really, aren't they, to a post-long COVID. So I can see why some of the research, they're starting to think, well, is this the same thing? You know, post-viral syndromes, they tend to be from herpes, enterovirus, rubella, candida, chlamydia, Coxsackie, cytomegalovirus, Epstein-Barr, Giardia even. And the interesting thing in those situations is exercise is not a cure, because actually they relapse when they exercise. And that is something that you see in long COVID. So there is certainly a connection. The mode of action may be a little bit different, but there is definitely, I think, some similarities in the dysfunction. So okay, I'm just going to talk about a little bit more about my own personal. I've been treating people, both hands-on and doing remote work, or people all over the world actually, with a variety of quite severe, actually, from very, very severe post-COVID, where people, you know, have been in bed for 7 months and haven't got out of bed and can't really walk, you know, to people who are just left with breathlessness and digestive problems, etc., to people who have heart issues. And there are, I suppose, you know, talk about the key elements. You have to engage with the vascular endothelium because it's beautiful to treat. It's so responsive. It engages sweetly. If you meet the quiet stillness in the vascular lining, it just engages. It's beautiful. There's this lack of fluid fluctuation. There's no longitudinal fluid fluctuation of the cerebrospinal fluid. So you have to get that back, restore that fluid fluctuation, CV4, etc. There's often, in a lot of these cases, there are some degree of hormonal dysregulation. The HPA axis or the HPA the HPO axis or the HPT axis, thyroid axis, all of these axes aren't right. There's often thyroid issues. And, you know, the very key area is, of course, the third ventricle, you know, this idea of potency in the third ventricle, because, you know, this is the center of the, you know, it's surrounded by the thalamic nuclei, the hypothalamus, the pituitary, the pineal. It's a key area for the regulation of all these areas. And it's like that thing when someone's low or they're depressed or they've been ill, there's no light in their eyes. There's no ignition. And so restoring this potency to the tissues, especially to these core tissues, is really important. It's a fundamental when you're working, in my view, when you're working with this. Then you've got the dural membranes, the connective tissues, all the fascia that just have no glide, no fluidity. Poor oxygenation. It's incredibly poor. So, you know, working with the lung fields is so important. The gut lymphatics, the pancreatic enzyme seems to be disturbed a lot, and the pancreatic duct seem to be disturbed. So there's a lot of basics here. I just want to talk a little bit about the cognitive effects, you know, because it's attention, it's executive function, prefrontal cortex, it's memory, it's processing. And these are, a lot of people are affected by these. This happens a lot of the time. And again, we need to restore the fluid function, the freedom of movement, the dural membrane, get everything functioning, breathing, moving is so important. And it can really support that process. I just want to talk a little bit about the psychological, the psychodynamic effects, because it's really important. There's, as I was saying, sort of 50-60% anxiety, depression, etc., irritability, this irritation is very common. A lot of people, actually most of the people who I treat would complain of this idea of irritability. But talking about depression, when the ignition is low, especially in the third ventricle, the lights aren't on, we have this, it affects, I think, the dopamine serotonin pathways in an intricate way. And how can you not feel depressed? It really, like, your lights are out. Anxiety, it has a very specific, what is an anxiety caused by shock? Because there is actually an emotional, if they get severe COVID, there is an emotional shock, and there's a physiological shock. And shock actually is something, I'm going to give a lecture next week on shock and concussion, because I think it's a really important subject. In shock, you have you either shut down or you disassociate. Okay, and often you can do both. So there's poor vagal tone, the sympathetics override everything else. This can create, of course, a pattern of anxiety. Shock can lead into anxiety. Physiologically, you see, because actually the amygdala is facilitated by the physiological shock and the vascular shock that's happened through the process. So what is actually an emotional anxiety and what is a physical or physiological anxiety? Sometimes it's both, and sometimes, and sometimes it is actually purely physiological, which is very, very interesting, and you can actually really work with that. But of course, there are huge emotional components like grief, loss of old life, fear of getting it again. But on another side of it, which I think is very interesting, and you see this with quite a few of the cases I've seen, there is this sort of initiation of more of like an existential crisis. It brings on, and when people, you see this a lot when people have a severe illness, it initiates or ushers in this fundamental shift in the person's relationship to themselves and the world. And I suppose it's, if you go through a near-death experience, but they're and obviously in a lot of the cases that I've seen, because they come to you, I suppose, there is this focus on healing and transformation. So I always, when I'm working in these situations, always look at it as a opportunity. They're still alive, which is huge in this day and age, with this particular virus, this rebuilding oneself anew. So it's taking the opportunity that the illness gives, and these horrible symptoms, actually, completely debilitation. But as we go through a healing process and a transformative process, hopefully it has effects on much. That's a whole subject, but I don't want to talk about that too much. But it's something to have an eye to. I think it's really important. So what we seem to be doing is literally kind of, in some of the cases, you're literally rebuilding everything anew. Everything has to be literally go through healing processes, and it takes time. It really takes time. But in our roles as practitioners, we have a huge role. If we are physios or if we're structural osteopaths, releasing the ribs, getting the lung fields going, getting the diaphragm functioning free, working on the spinal autonomics, the blood supplies, beautiful. Then we got the more subtle things like functional techniques and working with connective tissue, beautiful. Actually gets all of that connective tissue free. If you're working more on the cranial, kind of looking at tide, ignition and precision with some of the internal organs, hugely important as well. Acupuncture, all of these kinds of modes of therapy are hugely important, I think. The one thing I would say is don't build in the exercise too fast, because people tend to relapse if they overdo it. They know though, because they feel it straight away. So it's a steady thing, and doing exercises that are more like yoga based, slow, gentle, restorative yoga, or building up your strength, doing qigong, tai chi type practices seem to be the best, seem to be the most effective ways of strengthening without overloading the system. And my experience, I've treated quite a few now, and I'm sure we're going to be treating an awful lot more, is people progress. They don't know, as this research says, that actually you can, if we intervene, I personally feel, this is my own experience, that actually you can make big changes and people can really start recovering. And so it's huge work. And what's been fascinating personally for me working in these cases is I've learned so much about how organ systems interrelate. And I've learned so much about the intricate anatomy of the endothelium, the vascular endothelium, and how wonderful it is as a mode of access and a way of engaging and working with people. And so actually it's taught me a great amount, actually. All of these people that I've been working with, I've learned huge amounts. And not just from this multi-organ system, and how when you're working it flips between one thing and goes to the next thing that the body needs to shift, and how the body goes through this process of trying to heal itself. And it's incredible, actually. Wonderfully rewarding process to work with these cases, and something that we all really need to do. This is why I'm talking about this and I'm sharing this, because I think that there's a lot of need out there. Obviously, I don't know. It's interesting, this piece of research that I quoted at the beginning. There's no research really about the rates, the amount of people who have long COVID. They haven't got that research. I've never not come across any research about rates of it yet, because there's a lot of people who have COVID and can have it quite severely, who they don't necessarily feel that much. They can feel a little bit weak, or they're not fully, but they're not debilitated and can't walk kind of thing. But there are plenty enough, certainly the ones I've seen, who start that way and have quite marked long-term symptoms and all these opportune other infections that come in and take over as well and cause trouble. So it's a great opportunity to really support these people and really make some progress. And I think it's vital, if you're doing hands-on or hands-free, it doesn't matter, both work, and both are valid, I think, very much so. So that's a little bit of an update. I mean, there's, you could talk about, because every organ system's involved, it's like when you're talking about treating preemie babies, you can teach the whole of what we do just looking at COVID, because it covers every organ system pretty much, from the brain to the rest of the organ systems and the emotional being as well. So it's a whole thing. And so this lecture could be about 6 hours long, really, if we kind of went into all the micro details. But it's just a little bit of an overview. But all I would say is, get your hands on and start treating these people if you're not doing so already, because they respond, and it's valid and it's very important. And I will come back to you with another. I'm sure I'll come back to you with a few updates about this, actually, as the research comes out and as experience grows. And we still have that Facebook page where we can share stuff and any research that comes out, and I need to actually get a bit more active on that, and share some of these bits and pieces that we found. I think that's quite a nice thing, because we need to build up this body, because actually, as they're doing in all forms of medicine, everybody's learning and growing, as in how to treat acute COVID and how to manage more long-term COVID in other situations. And this is the point, is everyone's coming together, sharing information and growing and learning and embodying our experiences more will skill us up, so we're more able when we're in practice to actually, and so keep notes. That's what I would say. If anything struck you, and please share, because I think it's it's invaluable for all of us. You know, we're all learning here, absolutely. So I think I'll do couple of these lectures if they're of value to practitioners, because you know we have to do teaching in various different modal forms now, and you know I've got all my online courses, etc. But we need to keep sharing and keep kind of growing. And I'll talk about shock and concussion, and I will at some point give a little talk on remote work, because people keep asking me for that, and just a little introduction into that world, because it's incredible. Actually, it's, you know, the precision is even more than it would be hands-on. It's very interesting. Anyways, I wish you well, and we will speak soon. And get out there and treat people.